Hello, my name is Jessica Boyd, and we're going to begin the webinar. I am with Child Welfare Information Gateway, and we are proud to welcome you to the webinar, If You Build It, They Will Come, Lessons Learned Through the Implementation of Text and Chat Services for You. Just a couple of housekeeping items as we get started. This webinar is being recorded. Currently, all attendees are muted. If you have a question, please use the Q&A feature to ask the questions throughout the presentation. We will have a time to address those questions at the end of the presentation. To use closed caption, you'll go to the bottom of your Zoom taskbar. Right in the center, you'll see the CC. You want to click on that in order to see closed captions. Materials for today's webinar will be sent out via email following this webinar. And I'm going to hand things over to Jan Schaefer to get things started.
Good afternoon, everybody. This is Jan Schaefer, Division Director of Program Innovation, and it is absolutely my pleasure to open this webinar this afternoon and to welcome you. As many of you know, the Children's Bureau uses a competitive peer review process to award discretionary grants for research and program development to state, tribal, and local agencies, to faith and community-based organizations, and other nonprofit and for-profit groups. The focus areas of these grants span the full spectrum of child welfare from prevention to permanency. The majority of Children's Bureau funding is distributed to states and territories through formula grants, but discretionary grants provide an opportunity to create learning labs in the field. It's often because of this innovative work or a focus on how best to do the work that child welfare practices changed based on the lessons learned and evidence built from these grant programs. This brings us to the PACTech project. Technology has changed the way people communicate and interact with each other. It is so important that service providers, especially those who work with children and youth and young adults, evolve with technology and understand how best to meet their needs through these modalities. Through a competitive grant process in 2018, Childhelp Incorporated was awarded funding through a technology innovation grant from the Children's Bureau. The Prevent Abuse of Children Text and Chat Hotline, or PACTech project, provided an opportunity to plan, implement, and research text and chat services in a hotline environment with a target population of 13 to 24-year-olds in a primary issue of child maltreatment. Today, you're going to hear from Michelle Fingerman, Vice President of Prevention Programs at Childhelp, and Laurel Jacobs, Director of the Hotline, on the lessons learned from the PACTech project, from the technology to key considerations around safety, privacy, and creating an environment where people feel comfortable when reaching out for assistance. I hope this information is helpful to you in your continued work with children and families. I thank you. And with that, let me turn it over to Michelle Fingerman. Thanks.
Thank you, Jan, for the warm introduction. And I would like to begin by first expressing our gratitude to both the Children's Bureau and the Child Welfare Information Gateway for their support both in this project and in this webinar series. We're excited to be here today to kick off the first of a three-part webinar series, which will highlight the findings of our 5-year project. Today, we will share overall lessons learned during the project, and the intended learning outcome is to understand the multifaceted components of implementing and operating text and chat services to support youth in the victim service setting. As a disclaimer, this project was funded, as Jan noted, by the U.S. Department of Health and Human Services, Children's Bureau. The findings and information we'll present today are results of the work completed by us here at Childhelp during the project. To get started, I want to first give a brief overview of Childhelp and the work the organization as a whole does throughout the country. Childhelp has been in existence for almost 65 years and remains one of the oldest and largest nonprofits focused on child abuse and neglect issues in the nation. Our services range from prevention to intervention and treatment, including services of a residential treatment center, to group homes, as well as foster and adoption programs. Childhelp also operates 2 child advocacy centers, which are safe spaces where children go through forensic interview processes, and all agencies are co-located in one space, which lessens the trauma of having to be interviewed by multiple people in different locations. And Childhelp also has 2 national programs. First, we have Childhelp Speak Up, Be Safe, which is an evidence-based child abuse prevention education curriculum. And it's the only one in the nation that is evidence-based all the way from pre-K through grade 12. It's delivered to children and youth in settings such as schools or after-school programs, and it builds safety skills to prevent and interrupt various types of abuse, including physical, emotional, sexual abuse, neglect, bullying, and cyber abuse. And finally, what we are here to focus on today is our other national program, the Childhelp National Child Abuse Hotline. The Childhelp Hotline has been in existence for over 40 years and is the only national hotline with a dedicated focus on child abuse and neglect issues. It's available 24/7 through call, text, and chat, and is staffed by professional counselors. Our hotline receives approximately 100,000 contacts annually and provides information, education, crisis counseling, support, and connection to community resources. An evidence-informed practice model is really our foundation of the hotline, which was actually developed during this 5-year project and prioritizes a focus on research and making data-informed decisions to best support both those seeking help from our hotline and our counselors on the front lines. These 2 priorities will be the focus of the presentation today. But before we move forward, it's important for us to distinguish that we do not and cannot take reports of child abuse, as the reports and investigations do go through the child welfare agencies at the state and sometimes even the county level. Each organization has its unique and distinct role, and they run parallel to one another by offering different types of support to youth and families. So with that being said, we're going to put up 2 really quick poll questions to understand who's in our audience today. Right? It looks like we have a nice blend of people here from child welfare agencies and community-based organizations as well. And I think that you'll find that as we go through this, that the findings really are relevant to both settings. So really happy to have somebody representing all forms of agencies here. And Jessica, I think we have one more that we could throw up. We'd love to know, does your organization offer text and/or chat services so we can understand if you're already on this journey or just thinking about it? Great, looking at these results. And I think we still have a few coming in, but it looks like, again, a very good representation of people that are already offering these services, some that are considering, and many that have not yet considered. So again, I think hopefully our information presented today will be applicable to all of you and where you are as it relates to text and chat services for youth. Thanks for taking the time to answer our questions. And as we move into the core of our talk today, it's important to note that our intent is to share high-level considerations today, but while also sharing examples from our specific project and what we implemented. Our goal is that it might prompt you to apply the information and findings in ways that are individualized to your organization. And whether you are an operational person or a clinical person, we have something for you all, as we'll really be talking about both aspects today. I'll start here with this slide and talking about why text and chat and moving into the operational considerations first. Text and chat services for us were formally launched in 2019. For several years prior, our leadership team began to ask the question, if we can go back one slide, please. Why are the callers adults calling on behalf of children? In fact, over 90% of the callers were adults. Our team knew that youth needed firsthand support, information, and access to resources, but they were not reaching out through call. We began to hypothesize that youth were most comfortable communicating through text and chat. This generation has grown up with technology, and child abuse is also a really difficult topic to talk about. So our hypothesis was perhaps youth would reach out more if we offered support in these new digital formats. It was at this time we embarked upon this 5-year project, which was twofold. First, to implement text and chat services to the hotline, and second, to include a research component to understand who was using the service, what issues youth were reaching out for support on, and to establish best practices in communicating with youth through text and chat modalities. As you can imagine, it becomes more complicated when there is no eye contact or ability to read body language. And then we also take away voice tone and inflection that we have when supporting youth over the phone. While our research initially focused on this quantitative data, the team really quickly realized the importance of adding qualitative research to the project, which ultimately led to the practice model development. And one of the biggest outcomes for us, the realization of the true value of collaboration between community programs and academic research professionals. As we got started, the team had already done considerable research on technology systems and other aspects of implementing text and chat services. Our formal implementation period was 4 months. Because of this preliminary research, we assembled both an internal and external team. The internal team consisted of experts from respective areas such as IT, marketing and communications, program leaders, and legal counsel. It was important for us to have everyone on the same page and processing through the many decision points together. Our external team, or advisory committee, was able to guide us from a broader perspective and also share what worked for them if they had already implemented any form of online services. Our advisory committee consisted of representatives from child welfare agencies, other victim service helplines, law enforcement, and frontline crisis counselors. We really came to understand the importance of learning from others, as at the end of the day, we are really in these roles to ensure that victims of child abuse receive the support and services that they need. The decision on which technology platform will work best for your program is really one of the most critical decisions to make. Will you use the same platform as you use to take calls, or will counselors be navigating between multiple systems? Is the platform user-friendly? We quickly learned that our frontline team required higher technology proficiency with text and chat offerings. In the hiring process, we then began evaluating technology skill level much more formally during the interview process. While we had technology to log calls before on a contact form, text and chat proved to be much faster paced, and it required much more comfortability in navigating multiple steps to ensure the interaction was seamless between the counselor and help seeker. And new hire technology training had to become much more in-depth as part of our curriculum. Another significant operational consideration is how you or your technology will initially greet the person reaching out. Technology systems allow for automatic bounce backs, but there are also often character limits in those bounce backs. So it's important to ask, what is the most essential information you are wanting to convey? What impression will the language in the message give to your help seekers? While it may not seem like it would be a big task, it is, and it needs to be. This is the first impression of the service, and it should provide clarity on what the service does, and sometimes even on what the service does not do. For example, we quickly learned that people reaching out thought that we were the reporting entity. Once that was identified, we had to work to ensure our messaging was welcoming, but also clear that we are not the agency to investigate cases of suspected child abuse. Our team had to go through several versions of this messaging, and it was in part due to the realization of two things. One, people thought that we were the reporting entity, And two, unfortunately, with technology, we found that there are a lot of bad actors and people will misuse the service. So our bounce back messaging had to be adapted to address both of these areas. Finally, another critical question to consider when implementing text and chat services. Will all counselors take all forms of contacts? For us, initially the answer was yes. But as we progressed through the project, we came to realize that the skill sets were actually quite different. And this was for a couple of reasons. With calls, our counselors were used to primarily supporting adults, while the majority of text and chat help seekers ended up being youth, and the needs were very different, and the communication style also needed to be different. Also in text and chat, words and messages can easily be misconstrued. In calls, our voices can convey warmth, concern, words to show that we're actively listening. In text and chat, this proves to be a lot more complicated, and words need to be exceptionally intentional. Our findings over time determine that text and chats are a different skill set than working with callers. And because of this, we developed a separate set of core competencies, which Laura will go into much more in depth in just a little bit on the clinical side of this presentation. As with any service, there are legal considerations and decisions to be made. And as a disclaimer, we have to give, this is not legal advice, and it's not a comprehensive list of legal considerations, but rather a few that our team found critical to come to a decision on before implementing these digital services. The terms of service should be comprehensive and provided to users up front. This may be through a link to another location where you house the full set of terms, because again, it will be limited in the characters that you can send through your messages. You may also want to consider a consent step to progress forward to the interaction with a counselor. An example of this is requiring the help seeker to type yes. This also helps eliminate bots entering your service. There should also be information on how to stop communication with the helpline at any time. It's important to be clear about your mandated reporting requirements. In addition to including this in your legal terms of service, all staff should also be extensively trained on this topic. That is a whole separate issue, which would be its own webinar, so I'll leave that point at that. Another one of the critical decision points is whether your service is anonymous or confidential. In this day and age of technology, there is so much personal information available. Do you want to see the IP address or SMS number? Do you want to mask it for the frontline team, but have supervisors have access to it in case of emergencies? These are important decisions your team will need to make together, and it will play a role in which technology vendor you choose. It's also imperative to be transparent about this information to those seeking help. Some pros of having the information available includes having access to identifying information to send help in life-threatening situations, and also the ability to combat chronic misuse, because unfortunately it will happen with these services when working in partnership with law enforcement. But some of the downfalls of having this information includes some users are really hesitant to reach out to the service if it's not anonymous. And with so much technology progress in recent years, it isn't 100% reliable. Bad actors have really learned how to mask IPs and SMS information, or even make it display as somebody else's information. And finally, with text and chat, there is now a written record of the conversation and the help that was provided from the service to the individual. So consider how long you will retain that transcript. For us, our time limit is 90 days. But then consider, will that retention timeframe meet legal standards for the work that you are performing? And will that change if a mandated report is made? What is your internal process if a transcript is requested by a third party, such as a child welfare agency or law enforcement? And finally, How much time does your team need for a good quality review of transcripts? The technology system you're exploring should have the ability to retrain and actually also to shred transcripts at your desired intervals, so you are not housing those for indefinite periods of time. So as you're hearing, choosing the technology system is such a central piece of implementation. The final piece of operational considerations that I'll talk about today is data. Our second webinar in the series in July will dig into this extensively, but a few highlights to share as it relates to items to think about when choosing a technology platform for text and chat. What information do you want to collect? Perhaps it includes information during or after the contact. Maybe it's information before the help seeker connects with a counselor. For us, our counselors collect non-identifying information on each contact, including age range, gender identity, presenting issues, types of service provided by the counselor, and referrals given. We also explored if it was possible to make changes to the data collection variables in the technology system ourselves, rather than relying on the tech vendor to complete it, which can take more time to happen. A helpful hint we learned along the way: when making changes to data collection variables, document the changes, including what change was made, when it was made, and why. This really assisted us when working with researchers who analyzed the data over a long 5-year project. For our PACTech project, it was also essential for us to understand who our users were and how they felt immediately after contact with a counselor. So during implementation, we wanted to know, are pre and post surveys possible? And what do the actual mechanics look like in deploying them from our system? We chose to do open-ended questions in the pre-survey to allow the help seeker to provide more specific but limited information. With that, there were a few factors to consider in the pre-survey, including the reading level of the questions. We wanted to ensure our target population would understand what is being asked. We wanted to keep the information brief in nature and relevant to the priority information that will help the counselors best serve the help seeker. And we also wanted to consider, and we implemented, an opt-out. So these pre-survey questions could be bypassed if the help seeker needed to get straight to support or preferred not to answer the questions. In the post-survey, it's really important to be intentional about what you are asking. It's an excellent opportunity to learn more. Over the course of the project, our response rate averaged 25 to 30%, which is actually pretty good. The results allowed us to understand how our young help seekers, 13 to 24, felt about the support they received while interacting with a counselor. We'll share much more about the findings over the 5 years and both the pre and post survey results in the second webinar. With all of this data, it really adds up quickly. It's really key to have a system that can support the collection and storage, but also personnel to manage it, analyze it, and probably most importantly, leverage it to inform the services that you are offering. So with all of that operational information, I'm going to turn it over now to Laurel Jacobs, the director of our hotline, who will walk you through some of the clinical considerations when implementing text and chat services. Laurel?
As Michelle said, she took us through a lot of the logistical and operational considerations for implementing text and chat, and she actually touched on several areas that I'll talk through from a clinical viewpoint as well as application of the service. As mentioned earlier, text and chat services require a certain level of tech savviness, but it also requires that significant intentionality in order to ensure that communication is effective and truly supportive to the help seeker reaching out for victim-based help. For us, this was highly centered around the target population being youth and young adults. Instead of talking with and providing resources to adults concerned about child abuse issues, text and chat conversations were commonly engaging with youth that are unfamiliar with child welfare systems, and many of which were actively experiencing abuse and mental health difficulties. Being able to adapt language for developmental differences and using terminology that was easier to understand was just as important as recognizing the emotional support that those help seekers needed. After launching in 2019, text and chat services were just beginning to grow in volume when COVID isolations were imposed, which had its own unique impact on the target population as well as on our hotline team. Reflecting back, this timeframe was one of significant growth for our hotline, but it also highlighted the intensive differences in the modalities. As you can imagine, building genuine rapport and providing emotional support along with guidance through only written words can be quite complicated. Recognition of this difficulty is what prompted that qualitative element of our research, which established our practice model, guiding productive conversations. Training and supporting the team to provide this nuanced hotline support has been an important area of focus throughout the PACTech project. So in addition to the extensive knowledge about child abuse and reporting systems that our counselors need to know, and in the process of establishing the practice model for the hotline, a set of core competencies was identified as being beneficial to hotline work. These were broken down into categories of knowledge, skills, and perspectives. And a few examples include developmental knowledge, manifestations of trauma and mental health issues, ability to assess needs and safety risks, clear communication and healthy boundaries, accurate data collection, as well as awareness of implicit bias and trauma responsive techniques. I'm going to come back to those in a moment, but I also wanted to mention that the potential for vicarious trauma is prevalent in crisis intervention work. And along with the increased difficulty of providing that support, staff well-being has been another focus for this research. It was considered strongly in multiple training efforts. Staff well-being is also what prompted the implementation of reflective supervision model for our team. This is an evidence-based model of providing support and professional growth in a trauma-informed work environment by intentionally establishing space to process and problem solve difficult experiences in crisis work. Training the whole team how to live into and effectively utilize reflective supervision has been an important consideration for PACTech grant success. Okay, so as promised, this is a snapshot of those competencies that were identified along with our research partner as being associated with best practices. These are shared in new hire training, and they provide the foundation of expectations for our counselor role. These elements also guide many of the supplemental monthly training efforts with the counseling team, because all of these areas can continually be refreshed and reinforced. There's a saying that you cannot pour from an empty cup. And we have found that counselors that are both empowered through training and supported to adhere to best practices are going to be able to maintain high quality services the best. All right, back to those initial considerations for implementing text and chat. Part of the PACTech grant was to increase awareness of the service to the intended recipient. So for us, youth and young adults were the target population, and that meant ad campaigns and outreach had to focus to where those populations spend time. Childhelp engaged in some exploratory efforts, creating ads for platforms such as Spotify, online magazines, but the most effective campaigns have been through social media, which I'm sure is no surprise. TikTok continues to have the most engagement, along with Instagram. Our national project was fortunate to be able to engage in a couple large campaigns through streaming services such as Disney, FX, and Hulu as well. And while rather costly, they do have a noticeable impact on volume. So if another organization were to have that opportunity, something to keep in mind is the workforce management needed in order to ensure that those needs are met as volume increases in response. Having youth as the target population also influenced automated messaging on text and chat. Michelle touched on this a bit already, but it's such a good example of the ways that we adapted services to stay focused on the intended purpose, but still be responsive to what was happening in practice. The simplified greeting was meant to welcome anyone. Hello, I'm a Childhelp counselor. How can I help you today? But because that common misconception about Childhelp being a reporting agency, we found that many adults were coming through, starting the conversation by giving identifying information, but very few details, and then quickly leaving. And so our team had to really work hard and adapt to finding a balance in messaging that gives clarity for what the hotline provides and those necessary legal disclaimers, along with that messaging that is still welcoming. So that initial greeting expands. Hello, I'm a Childhelp counselor. This text line does not take reports of abuse, but is here to listen and to help by providing information, resources, and emotional support to individuals that are concerned about child abuse. How can I help you today? It's quite a bit longer, but it really does establish the clear expectation of the service right from the beginning. To be honest, address drops are always going to be commonplace on a digital service. But it is important to find that balance of addressing the misuse that occurs in practice and still prioritizing the experiences of the intended population. I'm going to return to that topic again soon. One more consideration of messaging that you might find surprising, but we found that there are benefits to efficiency of using pre-populated or scripted messaging within a system. There's also a negative. Frequent use of these types of generalized messages comes across as cold and robotic, and it often resulted in a very specific question from help seekers. Are you a bot? That question was common when text and chat first launched, and it's probably even more relevant today. In our experience, there's no replacement for human interaction and connection. The ability to establish rapport is much more effective when counselors can individualize messaging to the unique help seeker reaching out. And so being able to offer ways to provide both efficient, standardized messages along with the personally written ones is so beneficial for counselors. This topic is going to be covered much more extensively in webinar 3 of the series, which will go into detail about the practice model that we established through qualitative research of transcripts. And it's also going to contribute to that hot topic conversation of whether AI has a place in this line of work or not. As with any human-based interaction, there are going to be those bad apples that misuse or at least complicate the service. In our work, that comes in a few different forms. So spam is one of those automated interruptions that is kind of a commonplace annoyance from almost everyone's cell phones and email systems today. But as Michelle referenced a bit, you can implement behavioral elements to a hotline. So asking a person to ask questions manually, especially if they'll help set up the conversation, that can add an extra safeguard to the service. Prank, deceit, and overuse of the service, they're also relatively common for hotlines. But the issues relate back to Michelle's initial consideration of anonymity versus confidentiality and those legal or protocol issues. Not to be a broken record, but this area can also be pretty complicated in practice. The purpose of a hotline is to connect with individuals in need. And sometimes those needs can be intense, difficult, and even include some inappropriate or abusive behaviors. So the very first line of defense is always going to be related to comprehensive training of your hotline staff to be able to handle those interactions with consistency and healthy boundary setting. However, if an agency does choose to be confidential rather than anonymous, there are often ways that the system information can more concretely identify individuals that are more disruptive to services. Some of those examples might include an individual that is reaching out multiple times a day, spending hours and hours engaging in conversation, but showing little to no evidence of willingness to follow through on any of those steps. Sometimes those can also have elements of dishonesty where it changes the feel of the conversation for counselors. There are also individuals that use anonymity to prompt emergency and investigative involvement, sometimes without merit. Oftentimes those are called doxing or swatting, and that can cause a burden within the system as well. And then lastly, there are individuals that repeatedly attempt to engage in graphic, obscene conversations with an empathetic counselor. The ability to objectively identify and confirm that these contacts are the same individual can really help a team's consistency in addressing these through specific protocols or in collaboration with law enforcement. Word of caution here, technology is not a perfect science. There will be individuals that can hide their number or VPN, and there can also be very valid reasons for repetition. A good example is if you have a referral agency that tends to try to transfer calls to a hotline, and so those calls look like the same number coming in, but they're actually new individuals each time. The most important consideration is to recognize that these types of interactions will have an effect on hotline counselors, and seeking ways to thoughtfully respond to and handle misuse while still maintaining the hotline purpose for genuine help seekers, that's going to require intentionality. So this brings us to lessons learned, a simplified version of them. We titled this webinar, "If You Build It, They Will Come," because we found that opening up text and chat to youth and young adults in need really does simplify and improve access to services for that generation. But when it comes to ensuring that the service they received is truly confidential, safe, comprehensive, trauma-informed, and consistent, it can be complicated. Balance is a constant goal in this work. Examples that we discussed include striving to balance between the information and guidance giving and still attending to emotional needs in every conversation, or seeking balance in employees that are tech savvy, but also have those strong clinical skills. It can also be seeking balance in implementing protocols that provide consistency, but still being responsive to the needs of help seekers and hotline staff. There's always going to be this push and pull of priorities. Providing support through digital means is often more difficult, less efficient, and sometimes comes with an extra cost with technology. But these modalities also ensure access to services for so many that may not seek help otherwise, as well as those with speech and hearing impairments. Evaluating whether the intended goals and objectives of the service are being met is another vital component to high quality and sustainable programs. Partnering with researchers to deeply assess and analyze findings can be humbling, and it also requires quite a bit of coordination. But the collaboration can really validate the need for the service, and it prompts effective improvements, as well as contributing to the larger field of social services. Along those same lines, establishing a specific pilot period to do the evaluation and assessment of processes and data collections is really beneficial to efficient and purposeful adaptability as well. Sometimes you just don't know what you don't know, and that pilot period of trial and analysis really allows for streamlined growth. Lastly, we want to advise that IT support is crucial. An organization's technology staff must take a key role in both the implementation and maintenance of mechanicals and the technological side of the service in order to complement the supportive and practical elements of text and chat. The PACTech project has been an incredible learning experience for Childhelp, and it's allowed us to expand our services to so many more individuals that are impacted by child abuse and neglect. The research components of this grant firmly established our appreciation of and dedication to being an evidence-informed in decision-making. The accomplishments we've had have prompted us to ask, what else? What else can we do to support and connect with this population? This led us to additional projects in order to meet that same goal. So one example is we recruited for and created a youth advisory board of diverse young adults from across the country in order to more formally get input from our target population on how we can continue to support at-risk individuals. And it also prompted us to really expand the information and support provided through our website in order to continually be working towards that education, empowerment, and encouragement of help seekers in accessible ways. And just so I can emphasize the word balance one more time, let's add the disclaimer that while continual growth and improvement and expansion is important, it can also be overwhelming for the frontline workforce that is engaged in this difficult work. So we definitely found that implementing change thoughtfully is a vital consideration to mitigate potential change fatigue. So as Michelle kind of talked about, this has been a very broad overview of the PACTech projects, especially leaning towards those initial considerations. But we'd really love for you to consider attending the additional webinars we're having where they'll go into more depth on some of the other elements. Webinar 2 is going to lean into that quantitative data, as you can see from the title, Data Matters, right? Leveraging research to inform and evaluate youth needs. And it'll be presented with our research partners from Arizona State University, the Southwest Interdisciplinary Research Center, as well as one of our data managers. And then the third webinar is going to focus on that qualitative research that we did in partnership with Purdue University. And then that will spell out the practice model and how that practice model is now setting up our continuous quality improvement efforts with our counselors through evaluations and just ongoing monitoring and sustaining of services. Those dates will be in July and August, as you can see, and we really hope that you'll try to attend as well. We also, if you enjoyed this, we've also put together a guide of key considerations that spells out most of these topics. And this is available on our website for download, or you can even reach out to us and we would send it to you. But it hits all of these same elements of setting up text and chat. With that, I think that brings us to a question and answer time. To be honest, I'm not quite sure how questions work. If people put them in the chat, we would love to try to answer some things if there's anything unclear.
Thank you, Rhonda. I saw that and we put a link to that guide right here in the chat. That has all of our research on the website from that guide to some of our qualitative and quantitative findings, as well as the best practice model.
Okay, I think I see a question. How do we address children in RTC and lack of access to cell phone? Ooh, great question. Yeah, great question. I mean, the set of this is it does expand, the online access. I will tell you that that makes me think of even the COVID times when there were kids they had phones taken away from them and things happening in their homes. And they were using school computers and finding us online. So how you get that information to kids that are in a restricted setting, I would be unsure about that. But, I know kids are savvy when it comes to trying to find online connections. There's no questions. It was very clear, I hope.
Okay, Jessica, if you want to put it ahead to slides, we'll keep it open for Q&A. So feel free to ask or throw it in there if you have a question. But we'll also put on our contact information on the next slide for both Laurel and myself. Feel free to reach out. We found over the course of, and I love this question that came in, and I'm going to have Laurel answer that one next. Over the course of the 5-year project, as we started releasing some of our findings, people started to come across them, both from other helplines, and we work with other national helplines very closely. So we share back and forth best practices. So each one isn't reinventing the wheel. We continue to learn from each other. But we've also found outreach from child welfare agencies. For example, I will use the state of New Mexico, who was looking to implement a text line for youth because they weren't hearing from youth themselves to report alleged abuse that was happening. And they found great success in having conversation with us because while our roles are very different in the field, some of the mechanics and processes align very well. So we're always happy to have those conversations, share what worked for us, and a lot of what didn't work because there was a lot of trial involved. But Laurel, I see there's a question in the chat about what are some of the positive and negative points of feedback from your staff and counselors, which we've actually done some outside focus groups with them. But Laurel, I'll have you take that one.
Yeah, I mean, the thing that comes to mind right away, and we hit on it a couple of times, is as our team transitioned from the adults that we predominantly talk to youth, different issues, right? And so having to adapt to resource giving to more of the warm support, it felt clunky, I think, for a lot of counselors when it came to written. They have had to lean into the how to be warm through writing, right? And so then imagine that it's like you're having a paper graded all the time. right? Like, and we, of course, would always encourage, strong grammar to reduce any kind of, errors in understanding things like that. So there's a heightened pressure that comes with it. I would say that is the negative feedback, the hard part, right? Which is, it goes back to the training again and support. But the positives are when you get the holy grail moments of, thank you so much. I didn't think, no one was listening to me. Thank you for taking the time. Those moments do happen. We watch them happen. We watch how appreciative these youth are that when they're heard, even if their situation isn't something that goes straight to Child Protective Services, right? It falls into that emotional abuse area that, it's more coping things, right? They're still appreciative. And so that's that positive too. And I think what I also want to throw is that our counselors get a moment to recognize that they get to show that there are adults that care, right? In a safe place. They get to, you have kids that feel safe reaching out through this means to start to voice their needs, their concerns, their fears, what they're experiencing. And when someone is receptive and respectful, that might give them the bravery to go find an adult in their life as well, right? To really kind of set that up. And so I think our counselors really try to lean into recognizing that role.
I'll add with that one too. It's really why we developed or adopted the reflective supervision model, because it is that space to meet with our counselors on a regular basis to have those conversations that happen more organically. Again, easier than providing feedback in written format to a counselor, having a back and forth conversation of feedback, but also where they're wanting and needing support. So it's a process, it's a collaborative process, and that really has made a difference in having some of these hard conversations. Again, text and chat is a really unique skill set. I see a couple here. Laurel, I'm going to address Grace. I see you have in the one chat, do we have a preferred provider of technology? And I think my answer is going to be connect with us offline, right? And we can share some of the good, the bad, and the ugly of various vendors that we've used. I think one thing is consistent. There is not a perfect technology platform. They all have their quirks. They all have their positives and their negatives. Some have more limitations than others. So if you want to connect with us offline, I'd be happy to share our experience with various vendors. And Laurel, the next one I'd like you to take is, in my organization, daily communication is a requirement for program participation. Any idea on how we can reach 125 youth without doing what was mentioned, creating automated messages that are impersonal?
I'm trying to think through this because it sounds like communication does have to hit everyone in a broad way. And so I would say that there's still, kids can still recognize when it's like the lecture that goes to everyone. Like if you imagine a school presentation, if someone's giving a presentation, everyone's hearing the same thing. The individualization is important in more of the one-to-one conversation. So if that broad communication says, here's what's coming up the next week. If you need anything, reach out, right? When they reach out, that conversation is where it needs to be individualized, and it's not the cold standard robotic answers, if that makes sense, right? Unless each one of the communications is supposed to be to each person, then I would just say finding ways to individualize it to the right people, like to the population that you're talking to. If it's a matter of talking to senior, different age groups or things like that, anything you can do to make sure that the person knows that you're talking to them is what it's going to come down to.
Thanks, Laurel. I see two more in there. Are case managers on board with this message? We don't have case managers utilizing this in our organizations. It's all hotline services. But I know that many community agencies are having more communication via text with clients or youth or even parents or other family members. So I think that some of this could translate depending on your organization. But I definitely want to make sure we get to the next one, Laurel, which is in terms of having staff learn. This is a great question. And we truly went through this. To write via chat in a trauma-informed and young person-centered way, how did you start training staff to do this? we have a similar program, but we have not had training per se on the writing skills aspect. So we do a lot in phone calls and what the first step would be. And this is an excellent question because we found that, yes, it was a whole separate training we had to implement. And Laurel, if you could address that, that would be great.
Yeah, I even want to speak to, I mean, that writing skills aspect, it feels like pressure for a reason, but it's still important because miscommunication, like a silly typo can change the meaning of things. And so setting that expectation up right away, number one, is important for staff, but two, if there are ways you could use tools, Grammarly is something that we implemented where it would assess so that you give an extra layer of support to a counselor. So things like that, I would say first. Second, it takes a lot of training. If I tried to give you the super short answer when it comes to having those conversations, it goes back to that word balance again. Balancing some type of messaging that shows active listening, that shows I hear what you're saying, that sounds difficult, it sounds like this, some kind of reflection back, plus the information you have to give. That's kind of the way that you can get a better balance and a better result than just throwing information at people or just asking questions. It comes across as interrogative, especially to youth. We say don't should on teenagers, right? You should just do this, right? That they don't receive it well. It sounds like this. Have you considered trying that, right? You're still giving them an idea, but they receive it in different ways. So it's not a one and done training. It is multiple reinforcements. We find that counselors really love seeing phrases done well. And so like giving examples of conversations that go well, the disclaimer there is be careful because people will then try to copy that and it becomes a script. So you don't want to do that. So lots of examples. So finding those phrases and that formula that you can give counselors. And honestly, webinar 3 is going to go through that practice model. It will spell out a lot of those elements. So I would strongly recommend that you attend that if you're interested.
Yes. Yeah, so there's the mechanic parts of it, how to implement free technology like Grammarly. We still want to be professional with not having misspellings, having punctuation, even though we know kids, type U with the letter U and things like that, but we still want to have that professional presence. So there's the mechanics. And as Laurel said, the trainings on reviewing where a conversation went well, where it didn't go so well, obviously all de-identified. So there's not counselor names or any identifying information on there, and showing kind of those examples. They're real aha moments in training there as well. More on that in webinar 3 as well. And I want to make sure that we address Amanda's question too. We had the same issue with social media, that we don't use it a lot, but we did make a budget to place outreach, just awareness ads. This service now exists. And that's how we didn't have a strong following or presence on Instagram, and especially not TikTok as a child abuse nonprofit. But by able to have a budget and the creation of youth-centered ads that they could connect with, it's hard to ask for help or we're here to support you. Just making them aware of the service was something that we were able to do, but there was a budget required for that. And I know that we are at the end of our time. So as we conclude, and thank you all for the questions. These are all such great questions, and feel free, honestly, to reach out with us about any more. Our contact information is here. We sincerely hope that you found this information helpful. Thank you so much for attending the webinar. We hope to see you at our other 2 this summer. And as mentioned earlier, this is recorded and will be posted on the Children's Bureau website. And this concludes our webinar. Thank you.